One of the challenges is that anxiety is part of life, especially at times of transition. I think that's true of children and adolescents as well as adults. So clearly transitioning from school at the end of the year, wondering what we're going to do all summer, to wondering what school is going to be like in terms of the continuous structure, the rigors of an academic pursuit, as well as the various social pressures and social issues and demands that children will feel. So there is a normal, healthy, anxious time for families. It's when the anxiety doesn't go away, it becomes manifested physically, it becomes manifested emotionally. There might be episodes where a child refuses to go to school because of anxiety. If a child has a history of persistent academic failure or low performance, a child may refuse to go to school. So all the issues that were sort of going on in the school year don't disappear on the first day of school for kids who do suffer from an anxiety disorder. First of all, acknowledgement. Acknowledgement that there is worry. So routine attention is very important. How was your day? How are you adjusting? Interest both not only in the academics but in the social realm, behavioral realm as well, how a child behaves in school. Be careful of the school bus. That's a place where children pick up every other child's bad habits in that respect. So if the worry and anxiety that we would expect in a transition time does not seem to go away in the first week or two of school, it might be an issue of concern. In child and adolescent psychiatry, the apple doesn't fall too far from the tree. If there is a family history of anxiety disorders or depression, a child becomes at risk for anxiety disorders. Time to bring a child to the attention of a mental health professional is when the anxiety interferes in the child's life, and that includes their academic life, family life, social life, etc. When a child can't seem to perform in ways that they have before. What to expect? Depending on the age of the child, I know that for younger children I would want to meet with the parents, and sometimes that meeting may just be reassurance that what their child is going through may be within normal limits, especially if there is concern because of a family history, and it may or may not warrant a next step. So there might just be a parent consultation. It's also important to verify how things are going in the school day for the child, and of course then a meeting with the guidance counselor, the teachers, etc., if there is indication that the child is not doing well at school. It's always important to ask school personnel not only how they're doing in the classroom, but how they're doing on the playground or at lunchtime, in non-structured academic times as well.